I'm Dr. Steve Shelton. I frequently get the question about the role of naltrexone or Vivitrol in the treatment of opioid dependence. So let's get right into it. Now, opioid dependence is also frequently referred as opiate dependence. This can include agents such as heroin, Lortab, Lorcet, Percodan, Percocet, codeine, morphine, oxycodone, fentanyl, on and on. So the way that these opioids have their effect is by stimulating the opioid receptor on a cellular level. The naltrexone blocks that opioid receptor so that even if an individual were to take heroin or any of these opioids, it would have no effect. It would not be able to get to the receptor. Now, a short-acting form of naltrexone, or a cousin of naltrexone, I should say, which is very short-acting, is naloxone, and also referred to as Narcan. That's what's used in the emergency rooms when someone arrives in an overdose situation on heroin or whatever the agent might be. The Narcan pries that opioid off the receptor and blocks it and brings them out of that overdose situation. So the Vivitrol, the long-acting cousin of naloxone, can be given by injection once a month, and it's effective through the month. In fact, the FDA in their labeling tells us that as long as an individual has received their monthly injection of Vivitrol, naltrexone, they will not relapse. It's physically impossible to become opioid dependent at that time. Now, I should clarify, it doesn't mean they won't relapse by taking the drug, but it'll have no action. There's no reason to take the drug. They're not going to get high. They're not going to have any side effects and so forth. Now, people frequently ask, well, what happens if I'm in an accident? Something happens where I need relief of acute pain. Well, they can override that Vivitrol in the hospital setting. So that's not a problem, not an issue. So it's a fantastic treatment option. Now, for someone who's actively dependent on heroin or Lorcet or whatever it might be, we can't put them directly on the Vivitrol immediately. We have to first taper them off the agent they're addicted to. And we can use other drugs, other medications such as clonidine or forms of buprenorphine to help taper them off, help them through that withdrawal process, and then we can get them started on the Vivitrol. Buprenorphine, by the way, it comes under several different trade names such as Suboxone, Subutex, Zubsolv. So these are very, very helpful modalities as well. So the important thing for the addict is to reach out for help. And the important thing for the family member or friend, those that care for the addict, is to help point them in the right direction and support them with positive enabling, encourage them toward treatment while getting rid of that negative enabling, which allows them to continue to exist as an addict. Thanks for joining me. Now, below, subscribe to this YouTube channel for additional information, tips. Also, subscribe to our blog. You'll find lots and lots of helpful tips and lots of helpful information there as well. Thanks a lot.